Orthodontic treatment plan is all set, and I'm here to walk you through it. You can just call me Lorena. I'll be using these 3D simulations and your digital record to give you a comprehensive overview. Just so you know, all our plans follow the 2S3S standard, which is the highest design criterion in the clear aligner industry. Alright, let's start with your main concerns. Felicity Lily, 29 years old, and you mentioned you want to adjust your two front teeth because one of them went out. And so you're looking to put them back in, which we call this retraction. And you also confirmed you don't have any gum disease or loose teeth, and you had a filling down a couple of months ago. Also, based on the chat before, you got a general idea of the treatment timeline and mentioned your budget is around 500 RMB. Okay, I got it. And let's take a look for your facial field photos. We collect this to better analyze how your facial features coordinate with your bite. And from a macro views, your facial proportions are harmonious and balanced. But looking closely at your lips, we can see they are slightly protruding. And then we can see your smile photo. And your smile line is actually beautiful and very standard, except for the gap between your two front teeth. And we just close it. It's very making it more beautiful. And look at your profile. Okay, we can see an overjet, which means overjet. Normally, our upper teeth should be vertical to the lower teeth, sitting about 2 millimeters in front of them. In your side profile, the lips don't quite meet the standard eagle line. Here. That's the line from the tip of your nose to your chin because of the protrusions. And this is directly relating your front teeth come out. Since teeth are hard tissues and lips are soft tissues, the tiled teeth are essentially pushing our lips forward. Like here. And now let's look at your interior photos. Okay. Beside the overjet and the gap between your front teeth, you also have a deep overbite. Like here. And normally the upper teeth should cover about 1/3 of lower teeth, but yours cover more than that. This increase wear on our front teeth and affects how you bite in food. Improves extra pressures on your back molar for chewing, which can eventually affect your jaw joint, possibly leading to clicking sounds or limited opening. So correcting this bite issue is significant. All right, looking at your upper teeth. The alignment is actually pretty good aside from that one protruding tooth and the gap. You can see here. Only for this protruding teeth and the gap here. And a gap that's large can cause a lisp, which means the air leaking when you speak, and also will trap food debris, and which breeds bacteria and can damage your gums, potentially leading to gums like recession. So I have to mention you this question, this problem. And we can also see two small gaps in your lower teeth that we also need to close it. I also noticed your oral hygiene could use a little improvement. Besides the tools you already filled, a few back teeth are showing early signs of decay. You can see here a little small hole here. Yeah, so I'd recommend using a fluoride toothpaste and soft Bristol electronic toothbrush with a small head for cleaning, for better cleaning, right? Okay, now let's dive into your specific treatment plan here. Okay, this 3D model is one replica of your teeth. For this plan, we need to use the another things you need to do, which is here. The small red bumps on the models, this we call this attachment. They act as a handle or delivery point for the aligners to help retain and move your teeth. They are bonded to your teeth before you start wearing the aligners, made of safe filling resin, and won't damage your teeth at all. We can help arrange this as a local clinic for you. You can also do it for yourself, in which case our assistant will give you detailed instructions. Okay, here is the shape of your teeth before the treatment. Let's look at the process. Each blue step here represents the movement and effect of each aligner. You can see the gap between our front teeth closing and the lower teeth begin being intruded to fix the deep overbite. And let's see it again. Close the gap and intruded to fix the deep overbite. Intruded. Okay, and let's look at the side view here. And we can look at the front teeth retracting toward to the tongue side, which will fix the protrusion. You can see it's normally wind to vertical with the lower teeth here. And okay, we can see before, after. It's very uh, obvious to see the difference. And let's focus on the upper teeth. Since the gap is quite large, we need to pull them forward to close it. This will take more alliance because each set can only move the teeth within a safe range. I think we can see it again. And we close it slightly. Okay, now looking at the lower teeth, we we are also closing the gap and retracting the front teeth toward the tongues. Can see it. Okay, I will show you an overlay view showing the change. Okay. The blue shadow is the original position, and you can see the teeth have moved inward. And the upper teeth also show the same inward movement. Approximately one tooth position retractions. Can see here. About one positions, right? Okay, the results are obvious and effective improve both your bite and the gaps. And we can say it again. For this treatment, you will need 20 aligners for the upper teeth and 14 for your lower teeth. So the total treatment time will be about 10 months. After treatment, you will need to wear retainers to stabilize the bones and prevent your teeth from shifting back. Okay. Alright, that's covered the detailed explanations of your plan. If you have any question later, feel free to ask in our group chat. I hope you achieve a successful treatment soon. Thanks for listening and bye for now.